Good morning, guys. Today with us Parmesh, one of the victim of substandard transplants. That means he underwent transplant 3 years back somewhere in Pune. The results are very disastrous. And well, this is not new for us. I've been operating 17 years, a lot many repair cases. Today with us, Parmesh, I'm very thankful to him to give this video. And he has a very bad experience with a transplantation procedure. He already underwent in some other place 3 years back. I've been observing his case last 3 years. Now time has come to repair it, and that's what today I just wanted to ask him what happened between doctor and patient during the consultation. Those details. We are today going to repair this patient. Kindly remember, implanting the hair wherever we want, it's very easy, but repairing will take a lot of time, 3 to 4 times more effort, and difficult for surgeon also, very difficult for patient also, because they have to come second time, they have to come multiple times. These are the things. So all this today we are going to discuss with this patient. I want to know his experience, previous experience.
My name is Parmeshwar Patil. ನಾನು 3 ವರ್ಷ ಮುಂಚೆ ಹೇರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ತಗೊಂಡಿದ್ದೆ ಪುಣೆಯಲ್ಲಿ. ತುಂಬಾ ಬ್ಯಾಡ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್, ಹೇರ್ ಲೈನ್ ಏನು ಕರೆಕ್ಟ್ ಆಗಿರ್ಲಿಲ್ಲ. ನಾನು ಮತ್ತೆ ಒನ್ ಆಫ್ ದ ಬೆಸ್ಟ್ ಡಾಕ್ಟರ್ ಸರ್ಚ್ ಮಾಡಿ ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ರೆಡ್ಡಿ ಸರ್ ಹತ್ರ ಬಂದು ಹೇರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ರಿಪೇರ್ ಹೇರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ತಗೋಬೇಕಂತ ಬಂದಿದ್ದೀನಿ.
ಯಾಕಂದ್ರೆ ಬಹಳ ಕೇಸಸ್ ನಾವು ರಿಪೇರ್ ಮಾಡಿದೀವಿ ಅಂತ ನಿಮ್ಗೊಂದು ಕಾನ್ಫಿಡೆನ್ಸ್. ಸೊ ಈಗ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡ್ಬೇಕಂದ್ರೆ ಒಳ್ಳೆ ಸರ್ಜನ್ ಚೂಸ್ ಮಾಡ್ಕೋಬೇಕು. ಅದು ಎಷ್ಟುವರೆಗೂ ಅಂದ್ರೆ ಇಂಪಾರ್ಟೆಂಟ್?
ಇದು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್, ಬಿಕಾಸ್ ದಿಸ್ ಇಸ್ ದ ಸೆಕೆಂಡ್ ಟೈಮ್. ಐ ಹ್ಯಾವ್ ಟೇಕನ್ ಫಸ್ಟ್ ಟೈಮ್, ಬಟ್ ಇದು ಸೆಕೆಂಡ್ ಟೈಮ್ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಅದಕ್ಕೋಸ್ಕರ ನಾನು ಬೆಸ್ಟ್ ಸರ್ಜನ್ ಆಲ್ ಓವರ್ ಇಂಡಿಯಾ ತುಂಬಾ ಸರ್ಚ್ ಮಾಡೇ ಬಂದಿದ್ದೀನಿ. ನಾನು ಎಲ್ಲ ಬೆಸ್ಟ್ ಸರ್ಜನ್ ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ರೆಡ್ಡಿ.
ಸುಮ್ಮನೆ ಬೆಸ್ಟ್ ಅಂದ್ರೆ ನಡೆಯಲ್ಲ, ಬಿಕಾಸ್ ಐ ಹ್ಯಾವ್ ಟು ಶೋ ದ ರಿಸಲ್ಟ್ಸ್ ಆಫ್ಟರ್ 8 months ಟು ಐ ಹ್ಯಾವ್ ಕಾನ್ಫಿಡೆನ್ಸ್. ನಾನು ಗ್ಯಾರಂಟಿ ರಿಸಲ್ಟ್ಸ್ ತಗೊಂಡ್ಬರ್ತೀನಿ, ನೋಡೋಣ. ಆಸ್ ಅವರ್ ಪೇಷಂಟ್ ಆರ್ whatever, he is telling his experience about his previous transplantation. Well, as an expert, I wanted to give you information about hair transplant. Is when someone goes to the hair transplantation, what will happen, what's supposed to happen before transplant surgery, in between doctor and the patient, is most important task. Number one is doctor has to examine very well, show few markings to the patient, how he is going to get the hairline. All this important. Most of the time this goes, transplantation goes wrong because patient has some different expectations. As a patient, he doesn't know how it look after 8 months. It is a surgeon's responsibility to explain him, if you do this kind of hairline, what can go wrong. So when he explains that, probably he should show some visuals. He should show some previous patients, best patient, a bad patient's results. He should show to convince the patient which is the right plan. Because this is lacking. Why this is lacking? Because the patient, doctor must be in a hurry and doesn't want to take a full commitment to give a best surgery. Always the plan wise putting on the patient head, it's not a good sign. Patient doesn't know anything about hair transplant, I am sure about it. They only know about the results wise, other details, but not the plan wise. So surgeon's responsibility, doctor responsibility is to get him a best hairline before doing the transplantation. You should show markings, what is the best markings, what is the bad markings. You should show and try to convince, substantiate the plan, so that patient will get convinced. If not, patient will tell you, I want this hairline, doctor will do. End of the day, results will go bad, and doctor simply says, because you want this line, we did it. That's not the end story. That's supposed to be not the end story. The point is, what the patient has in his mind. Doctor has to explain the pros and cons of each plan. Then patient may realize, they can understand. That's the most important discussion should happen between a patient and the doctor before the transplantation procedure. ಈಗ ನಾನು ಹೇಳ್ದಂಗೆ ಆ ಥರ ಡಿಸ್ಕಷನು, ಪೇಷಂಟ್ ಮಾರ್ಕಿಂಗ್ ಎಲ್ಲ ತೋರಿಸಿ, ಮಿರರ್ ಎಲ್ಲ ತೋರಿಸಿ, ಪ್ಲಾನ್ಸ್ ಎಲ್ಲ ತೋರಿಸೋದು ಒಳ್ಳೇದಂತ ಇಲ್ವಾ? ಅಂದ್ರೆ ನಿಮ್ಗೆ ಪೇಷಂಟ್ ಡಾಕ್ಟರ್ ನೀಟಾಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದ್ರೆ ಇದು ಚೆನ್ನಾಗಿರಲ್ಲ ಅಂತ, ಅವಾಗ ಡಾಕ್ಟರ್ ಹೇಳೋದು ಕರೆಕ್ಟ್ ಅಂತ ನೀವು ನಂಬ್ತಿರಲ್ಲ. ಅವಾಗ ನಿಮ್ಗೆ ಐಡಿಯಾ ಇಲ್ಲ,
ಐಡಿಯಾ ಇರಲ್ಲ. ಆಸ್ ಪರ್ ಯುವರ್ ಸಜೆಷನ್ ವಿ ಗೋ ಥ್ರೂ ಇಟ್. ನಿಮ್ ಸಜೆಷನ್ ಥ್ರೂನೇ ನಾವು ಹೋಗ್ಲಿ.
ಯಾರಾದ್ರೂ ಆಗ್ಲಿ ಡಾಕ್ಟರ್ ಸಜೆಷನ್ ಕೊಟ್ರೆ ಒಳ್ಳೇದು. ಇನ್ಪುಟ್ ಕೊಡ್ಬೋದು.
ಪೇಷಂಟ್ ಒಪಿನಿಯನ್ ಏನೋ ಇರುತ್ತೆ, ಡಾಕ್ಟರ್ಸ್ ಒಂದು ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಇರುತ್ತೆ. ಡಾಕ್ಟರ್ ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಫಾಲೋ ಮಾಡಿ.
Patient has some suggestions towards the surgery. We have to respect it, and same way we have to tell in such a way that what are the pros and cons of each plan. Then both should match. surgeon's plan and patient expectation almost should match. Then only we can proceed with the best surgery. That's what we are going to do every day in our practice. Well, we would like to show these results after 8 months. Keep watching our channel. Thank you. When we say it's a repair transplant, what are the efforts that made by us is kind of starts from the consultation itself. During the consultation, a clear examination of the patient's scalp and different angles to understand what kind of results we are going to achieve in this patient, what kind of baldness is there, and then we design plans such a way that we mark and show the patient and educate them and which area we are going to implant, because the hairline marking doesn't represent the final outcome. The marking looks different and the final outcome looks different. Most of the patient doesn't know this. For that reason, we'll show them in the mirror also. We also observe in all these views to understand what way we can achieve the best results. So that really makes a lot of time to spend with the patient during the consultation as well as the surgery day to achieve the best results and make them to understand this version most of the clinics will miss, because during the consultation as well as during the surgery, they don't spend much time with you. There exactly you miss the important points. Actually, that is the most important point to be noted. So your surgeon has to spend a lot of time to understand your hairstyle, your ongoing hair loss, and what kind of markings he's making it. And not only for himself, it is for you also. It is very useful to understand what kind of prognosis, what kind of results you are going to get it. So that's what we made in this patient, and to all the patients we would do this to achieve the best results. There's a lot of mistakes in this case. If you can see, these angulations are totally wrong. We are going to remove all this now and we're going to fill complete this area. So we're going to fill everywhere and we are going to remove this. Remove will take a very painful procedure for the surgeon, but however, we're going to achieve very best results after removal of this few grafts both sides, and we're going to implant everywhere. This is the plan we're going to do today. Let us watch the results. In donor situation we have today, kind of a very challenging situation where a depleted donor, you can see this area being over harvested, and this area we cannot harvest now. We need to uniformly harvest now and without damaging the existing donor. This is a very challenging part for the surgeon in the repairing of any transplant. And this side, this is okay. Now when it comes to the front, I have a very challenging situation where this hair has to be removed. This has to be removed, and this bad angulations is to be removed completely, and even the other side also. And all these area we uniformly distribute such a way that a natural hairline should occur. So this is the wrong placement of the grafts one should think about, because this temporal angle one should not implant this way. There's a different manners to implant. However, we're going to remove all this and re-implant in the bald area. I think he may need another session to removal of these grafts too. Let us see. Now we are concentrating more on filling the bald area as well as removing these excess grafts today. Well, it happened to record this video after 8 months from the day of the surgery. This case we already discussed in the introduction that we repaired it because it's a repair case. Why this case went to repair? There are lot many reasons. Number one would be a kind of a budget transplant. Number two would be because a kind of selecting amateur clinics. Number three, where there is no doctors operating on you. Such kind of clinics probably reasons to get this kind of repair cases to us. Well, this case we repaired with excellent results. Probably all the cases we may not repair like that, because that's the important point to be noted, because he had little donor left in the back. That's the reason we are able to going to repair this case. Otherwise, there are few cases beyond repairable. Botch kind of transplantation, we have seen it. So don't think that each and every case can be repaired. So that's very important note to be understand about this video. And why you need to choose the best clinic, that's another reason. And most of the cases will ask me why it's so expensive. It's very cheap in different places, but this is the reason you're going to, if you fall as a prey for the kind of budget transplant, I'm sure you end up this kind of repair cases. And well, here, believe me, this repair had actually nightmares for surgeons in our clinic, because we had very tough time to remove all these grafts which is unnecessarily placed. A second very important point to be noted about this patient and video is, if you go by a surgeon choice, the hairline design, whatever it is, definitely you would get a best outcome. Otherwise, this kind of making hairline, implanting in the temple angles and without having any aesthetic sense, you would end up in definitely a disastrous outcome. This is another reason most of the youngsters will ask me, I want hairline like this, I want hairline like this, because they don't have an idea about how the hair transplant results looks like. Okay, so we put a lot of efforts to make them understand during the consultation as well, and even during the surgery also, by showing in a different angles, direct visuals, indirect visuals in the mirror, and even with the photographs. Then educate them such a way that which is the best line hairline is going to be suitable for you. Each patient it differs. So that is the reason a lot of efforts to be made to get repair cases. It's not a joke to repair the transplants. So kindly make sure you are going to an expert surgeon and listen to expert surgeon. The way you're going to get the hairline, whatever it is, can make you a good improvement and good results in future. And that's the moral of the story of repair transplants. We achieved best results in this patient. By God's grace, we did good effort and to make this video. And of course, I will be thankful to the patient and all our team, because this took a lot of time. Almost, you guys are watching only 8 minutes video, but it took almost 8 months for me to record this video with data. So thanks for watching our videos. Kindly keep watching for more information on repair transplants. Thank you.